Good afternoon, folks. Ron Ray here with Turning 65 Solutions. You know, one question that I always get is what about preventative services? Does Medicare pay for preventative visits and preventative services? Well, the answer is yes, they do, but a lot of your tests they're only going to pay for on a certain schedule. And a good way to find out is just go to the Medicare website, www.medicare.gov, and go to the preventative page. I'll put a link down in the description below. We're going to go through a couple of these. I'm not going to go through all of them just to save time, but some of the most common ones would be your one-time welcome to Medicare preventative visit. As soon as you go on Medicare, you'll be entitled to your one-time welcome to Medicare visit. And what this is Medicare is just getting kind of a baseline on your health. And actually, Medicare doesn't get any of the information. They're just allowing you to go to the doctor if you haven't been and get a baseline at your doctor. And then you can get your annual wellness visits every 12 months. And those are going to include your medical and family history, get any kind of updated list of your current providers, your current prescriptions, measuring your height, your weight, your blood pressure, and any other measurements they want to take. They're going to get any kind of risk factors and schedule any other kind of tests that they want to get. Who's eligible for this? All people with Medicare Part B. And what is your cost? Your cost is zero because Medicare is going to cover this. Now, what you have to be careful of is this part right here. You may have to pay co-insurance or Part B deductible if the doctor orders anything that's not covered under this annual visit. So sometimes your doctors will order a blood test that is not normally covered under a preventative visit. You may be responsible for the out-of-pocket cost on that. Now, if you have a good Medicare supplement, you still may not be paying anything because the Medicare supplement will pay your share of that cost. So that's your one-time welcome to Medicare and your annual checkups. Beyond that, there's some other tests that you may need. One of the common ones, of course, is a mammogram for the women. And you can get a mammogram every 12 months. And who's eligible? Women over 40 who have Medicare Part B. So there's an important distinction to make here. Some of these tests are annual preventative screenings, and some of them are diagnostic, meaning the doctor thinks there's something wrong with you, and he's going to go and find out. If it's a screening, it's preventative care. Medicare will take those on the prescribed schedule. A diagnostic test they're going to take whenever the doctor orders them because the doctor is going to provide that medical justification to Medicare. The screenings are free to you. Diagnostic tests, you pay your share of the Part B cost, the 20%. Now, again, if you have a supplement, the supplement's usually going to pick up that 20% cost for you, depending on the supplement plan that you have. So you can get a mammogram every 12 months as a preventative screening. Another one that I always get a question about is what about a colonoscopy? Colorectal cancer screening. Just your regular old screening colonoscopy means you have to get that screening. Medicare covers this every 24 months if you're at high risk. That means you've got some risk factors, meaning maybe you had colon cancer in the past, or you had some risky polyps the last time you had a test, or you've got colon cancer in the family. Those kind of factors add up to allow you to get a colonoscopy every 24 months. If you don't have any of those risk factors, Medicare is going to allow a colonoscopy only about every 120 months or 10 years. Now, there's other tests that can be performed for colorectal cancer, such as barium enema, fecal occult blood tests, also a DNA test. Those are going to be covered on a certain basis, but colonoscopy is probably the most common. That's just a few examples, folks. There's a whole list of them you can see here on the website. And of course, if you have any questions, you can give us a call here at Turning 65 Solutions. The number is 1-800-515-4031. The website is t65s.com. I'll put all the information down in the show notes below. Folks, if you have enjoyed this video, if you've gotten some value out of the time you've spent with me today, please like and share this video with your friends, and also subscribe to the channel. Just hit the subscribe button down below, and what that'll do is that'll give you updates. Whenever I post a new video, you'll get an update about it, and you'll be able to go and get some of this valuable information that we're trying to put out on a regular basis. Thanks for spending time with us today, folks. We'll see you later.